I'm a scholar. I'm a scholar at Bioquantum Academy, contributing to webinars and conferences. Plan to start my journey in the homeopathic world in 2025. It's my honor to be the conference moderator from Canada, along with Dr. Maria Grazia. I want to thank each of you for joining us, all of our speakers and audience members, students or researchers, and our dear guests. Before we begin, I'd like to take a moment to set the stage for today's session. Our goal here is to create an open, respectful, and dynamic space for sharing knowledge, insights, and perspectives. Each of our speakers bring a unique background and expertise, and we are excited to hear their views. Today, we will cover key topics such as the role of homeopathy in some situations like psychiatric conditions, autoimmune disease, or some parts of the body like thyroid and brain. Toward the end, we'll open the floor to questions from our audiences, so please feel free to jot down any question or comment that arise as you listen, to ask at the end of the lecture or write it in the chat, please. Now, I'd like to ask Dr. Parveen Zarin, the chairperson and head of the scientific committee. The conferences deliver her opening remarks. Welcome, Dr. Zarin. The floor is yours.
The floor was mine before. Thank you so much. I think, can we wait for a few more minutes that everybody joins at 10, or you want me to start?
Dr. Grazia.
Yes, let's wait till a few more minutes. We have 3 minutes actually that we can wait. Okay, so yeah, we can pause a moment.
Okay.
All right.
While we're waiting, I have a question for Dr. Farbat. How is it that her logo is lettered backwards?
It's
it's, or am I not seeing that correctly?
Oh, I think it's correct.
Well, when I'm seeing everybody else's, it says Bioquantum Academy, and yours is it's
actually mine is backward too. Actually, mine is backward too. I think.
I have a suggestion here. So you see it back. If you see it backwards, Dr. Parveen, we see it the right way. So that's what needs to happen with Dr. Farad. She needs to put it backwards for her so that we can see it.
I didn't mean to open up a can of worms here.
No problem.
For me,
I was just trying to fill in the time.
Right.
That's all.
Right. Okay. For me, it's not backward.
That's a great.
Yes, it will show that you have to see it backwards for yourself in order for it to be exposed frontwards. There you go. See, Dr. Parveen fixed it.
No, that's actually another one. So the one.
Another one? Okay.
Yeah, it's another one. The one that we sent to Dr. Farbot, maybe it was the newest. I think I can send it to her.
Okay, I will check it.
I apologize.
That's okay.
I'm sorry, Dr. Farbot. I didn't mean to open
it in the backwards.
Oh wow! Look at that.
It's almost. But look, it's almost time to start now.
Yes.
Yeah, we have 2 minutes.
Yeah. So we got everybody loosened up now.
Yeah, just 1 minute left.
That's my other role here. I'm the straight man.
My goodness, how smart the faculty of Bioquantum academies are.
Yeah.
So
I want to know how come I'm the only one who noticed it.
Actually, mine was like that too, but now I know the one that I sent to Dr. Farbo. I had almost 10 of them, so yeah. So
all right, it's going to be the great mystery of this conference. Okay, how are we going to fix that?
That's okay, Dr. Farbo. On the break, I'm going to send you the other ones, and you can change the background. Okay?
That's my other role here. Is I'm the troublemaker.
Yes, amazing, Dr. Khalifa. Please do not leave the conference. We need you.
Yeah, I'm the troublemaker here.
Exactly.
No, you're a problem solver.
If I hadn't said anything, we could have gone through this whole day with her logo looking backwards, and no one else would have said anything. Now
you brought everybody's attention to Dr. Farbo. So, That's awesome. Thank you so much, everyone, for joining.
All right. It's 7 o'clock at my time. Go for it.
Yes,
Here we go. Let's get started.
You were right on time. Thank you so much, everyone. So far, so great. And I'm sure that more people are going to join us. Just a little bit of time zone difference is brought a little bit of confusion in, around the world. So, but warmest greetings from Canada to all of you, our distinguished colleagues, collaborators, scholars, and participants. Welcome to the Bioquantum Academy third International Conference on the topic of the world of homeopathy and integrative medicine, past, present, and future medicine. I'm truly honored to be the conference chairperson and the head of scientific committee, and I would like to express my appreciation to the team of organizing committee, co-chairpersons, and the communication department for being the major part of the conference. During these 2 days, we converged to explore the dynamic intersections of homeopathy and integrative medicine to health and healing. I'm delighted to stand before this gathering of great scientists, doctors, experts, scholars, and participants who share a common passion for natural healing modalities and holistic well-being. In our pursuit of a healthier and more balanced world, this conference serves as a melting pot of ideas, a great platform for innovations, and a forum for the exchange of knowledge. We intend to break a century boundary of relying on one mainstream of synthetic and artificial drugs to treat imbalances and diseases. Together, we embark on exploring the world of homeopathy and integrating the best of natural modalities from ancient medicine and modern science in order to enhance the quality of life for people. Bioquantum Academy's educational platform is where modern science meets ancient wisdom. Over the next 2 days of the conference, we will delve into groundbreaking research, engaging in scientific discussion, and create connections to establish a foundation for our scientific endeavor. Our collective commitment to advancing natural healing modalities under one umbrella will transform and shape the future of healthcare, inspiring a paradigm shift towards a more holistic, comprehensive, and patient-centered approach. Bioquantum Academy created a health and healing movement to transform the healthcare system via its international educational platform. We are keeping our promise by delivering a vast amount of knowledge through our conferences, webinars, and educational departments to establish a brand new natural medical system globally. Let us unite as one community to pave the way for a healthier and brighter future for now and our next generations to come. Thank you very much again for joining us, and let's start our conference today.
You're on mute. You're on mute, Dr. Farid.
Dr. Farbod, please unmute yourself.
So sorry.
No worries.
Oh, thank you, Dr. Zarin, for offering educational platforms, webinars, conferences, workshops for doctors, scientists, experts, and also medical practitioners. Please allow me to introduce our first speaker joining us from the United States. Dr. William Clearfield is an osteopath, medical homeopathic practitioner, faculty and educator of Medical Homeopathy Department of Bioquantum Academy. The topic is a role of homeopathy in thyroid hormone optimization. Dr. Clearfield, the floor is yours. Please resume your presentation.
Thank you for having me on. The last conference, we talked about some general homeopathic remedies, and now today we're going to get a little bit more specific. Let me get my slideshow up. And it's a bit difficult for me to sort of switch gears and go from the regular medical doctor world, which tells us that the thyroid, which is your gas pedal, it's our energy source. And there's only one way to look at it, and that's we do a blood test, which is and you only do a thyroid stimulating hormone And if it's very high, remember this thyroid stimulating hormone TSH is an inverse. It's your detective. If it's very high, it tells us that we need to your thyroid is not running properly, and it's low, and we're going to give you Synthroid. If it's greater than 10.0, if it's 4.5 to 10, if you have symptoms, we're going to give you Synthroid. And if it's under 4.5, most of our medical colleagues will say it's a psychiatric or emotional problem, and to go seek out counseling, which we've learned is quite a wrong way to go. So we've done this with hormone optimization, with medications, herbal remedies, amino acids. And today we're going to look at it from a homeopathic standpoint, which is actually quite exciting because we're using the framework of constitutional biopsychotypes, or so each person we get their distinct personalities and the issues that they've been dealing with, and we use it. We try to frame our homeopathic strategies to match the patient's energies. It's not unlike those of you who don't know me. I'm also an acupuncturist. It's not unlike learning energetic medicine and matching our patients' symptoms to traditional Chinese medicine biopsychotypes also. So let's see how we can advance this here. I liken this, I can't go backwards on here. I liken most of my talks to nearly everything we learned in medical school about, and I fill in the blanks. So today is going to be thyroid issues was wrong, because it was wrong. And briefly, I'm going to give you a brief thyroid primer. We'll talk about thyroid disease and homeopathic remedies, root causes. We'll talk about homeopathic remedies in a specific system for balancing and optimization. So quickly, anatomy of the thyroid and parathyroids. It's located in the neck, just below the larynx. It has two poles, a right and a left, with a little island here called an isthmus. It has on the back, it has these little parathyroid glands, and the parathyroid glands are where calcium mostly is produced. The thyroid is your gas pedal. It is your energy. It's our source of our get up and go. It produces two major hormones and two minor hormones, T1 and T2. T2 is getting some looked at now. I always say that we just ignore those two because we don't really know what to do with them. T3 and T4 are the major hormones. And what's always overlooked in the medical doctor world is that the thyroid produces calcitonin, which is responsible for calcium balance. And if you look at the major medication that's recommended, Synthroid or levothyroxine, which is just T4, one of the quote unquote side effects is long-term is osteoporosis. Well, there's a good reason for that. The reason is that the thyroid gland produces calcium for distribution throughout the whole body, and we're not replacing it when the thyroid is diseased. 80% of the active thyroid molecule comes from what a conversion factor known as deiodinization and converting T4 to T3. This is the schematic of the thyroid molecules. And what I want you to pay attention to is that the T, by the way, is this protein called tyrosine. And most every thyroid supplement will have tyrosine in it. It's sort of like a stick figure here. So there's a head with no arms, and then there's two legs. That's what I liken it to. The number 1, 2, 3, or 4 are the number of iodines attached to the protein. So here's a 3, and here's a 4. The 4 is your store unit. That's sort of your backup, your store unit. The 3 is the part that does the work. But notice over here, there's another 3. And this is upside down. This is called a reverse T3. And again, I'll touch on this just briefly. The reverse T3 is inert. It doesn't work. If you're ordering blood tests and you order a T3, a total T3, it's the combination of these two. But what we're going to find out very quickly is we need to know what each one is. So we need to know what the free T3 is and the reverse T3. Okay, moving along. Here are the symptoms of a thyroid dysfunction. If there's no symptoms, then our patients aren't in front of us. 98% of the time, the patients will present to us with hypothyroidism. The thyroid is running low. The symptoms are dry skin, dry hair, the fingernails crack and break, constipation, the patient's gaining weight and can't lose weight. They're cold all the time. They have heavy menstrual periods. They have infertility. They are tired all day long, and it's constant. There's a difference between constant and intermittent. If it's intermittent, if they're tired in the morning, then they get some energy, and then they're tired again, and then in the afternoon they're tired, and then late at night they have a surge of energy. That's an adrenal or cortisol abnormality, and that's very different. And if we address the thyroid, and it's a cortisol abnormality, and they appear close. They closely align each other. We're not going to hit the mark of where we want to go. Hyperthyroidism, which we usually don't see very often, is pretty much the polar opposite. You do get a hair loss. You get that bulging eyes. If anybody's seen that movie, Young Frankenstein from a long time ago, the little gnome Igor had bulging eyes. His the actor's name was Marty Feldman. He had a classic hyperthyroid eye issues. They're hot, they're sweating, they're shaky, they have tremors. They go to pick something up and they shake. They can't sleep. They have heart palpitations. They have diarrhea and they lose weight. Their fingernails are soft and not hard and brittle. And where did we go? I don't know what happened to my slideshow. Okay, so I don't know what's happening here, Dr. Zarin. The conventional medical doctor model of thyroid disease is a failure to convert T4 to T3, and there's some acknowledgement that maybe there's some nutrient issues that can be involved also. In our integrative medical model, we want to look at the root cause, and the root causes I have over here listed on the right. There's what we call molecular mimicry, and what happens is that for some reason, our bodies are looking at the nutrients that they're taking in, and they're getting fooled, thinking that it's iodine. Remember, it's iodine that converts T4 to T3. And that reaction, and our body reacts to it by bringing in the cavalry when it finally realizes that there's an issue, and the immune system goes into overdrive. The reasons are listed here. One of the main ones is gluten and gliadin. So what we're eating, so white flour, white sugar, and dairy, those are the main sort of bad guys. Toxin exposure, the world's full of toxins now that we didn't have 60, 70 years ago. Heavy metal exposure is a main one. Lead, mercury, cadmium, arsenic are the main issues there. Infectious diseases, the main one that we see is Epstein-Barr. So someone who comes in, they had mononucleosis, which is from Epstein-Barr when they were in their late teens or early 20s, is a frequent source of infectious disease. Other ones would be hepatitis, Lyme disease, and H. pylori, and food poisoning, so Yersinia. We like if they see H. pylori. We've actually been able to reverse the H. pylori, and in selected cases, the thyroid disease goes away. Not often, but every once in a while. HPA axis insufficiency or adrenal fatigue, as we term it, which is not too much, not to the extremes of Cushing's disease or Addison's disease, but in between. Iodine deficiency, you know, as doctors are iodinophobic, and certain medications, amiodarone and beta blockers are chief among them, and synthetic progesterone, which are usually birth control pills. Laboratories, if you do laboratories, these are the ones that we need: TSH, free T3, free T4, reverse T3, 25 hydroxy vitamin D, the thyroid antibodies, TPO and antithyroid globulin. If they have hyperthyroid symptoms, we also do something called a TSI, and then we want a B12, folic acid, and ferritin levels. These are the laboratories. These are the normals and the optimals over here. I won't read through those. If anybody has any question about, what we're looking for, let me know if you're not familiar with laboratory tests. I just wanted to show you that these are the normals here. This is what the lab will report. These are what we call optimal. So the free T3, the part that does the work, we want it in the upper third of the normal range. This reverse T3, I'll discuss that in a second, and the thyroid antibodies, we want them, and you have to look at it because one major lab is less than 34. The main one that we use here in town is less than 9. So you have to look at what the calibration is on the lab test for your patient. And in the B12 and folic acid, we want that in the upper third of our normal. And quite frankly, they may get a little bit of, euphoria if the levels are very high, but usually you just urinate them out. The B vitamins are not an issue as far as toxicity. Now, vitamin D, on the other hand, is that it is an issue. You don't want too much vitamin D. These are, we go through all of the lab tests. There's some calculations we do. I'm not going to, because I want to get to the homeopathic portion of it. I'm not going to go through these all that extensively. I did just explain what each one does. These are the normals here, and B12, folic acid, and vitamin D. Reverse T3 is that inert T3, and it usually comes from 90 to 95% of the time, it comes from a cortisol abnormality. Now, it could be high or it could be low, but it's a cortisol abnormality. A normal lab test is about 9 to 25 on reverse T3. We start seeing symptoms when the level is over 15. So we want to see a reverse T3 less than 15. And we use this as a proxy for cortisol. Those of us who do testing, the gold standard is the 24-hour saliva test, where we present with 4 specimens in 24 hours, and we get that graph. You get the cortisol activating response within 30 minutes of rising, and then it falls down to a minimal level by noon, and it sort of meanders on down, and that's normal. But it's a $250 test in the U.S., and no insurances will pay for it. We can use this as a very good screening. This is about an $8 test, and it's in the blood, and it comes with our lab panel. It works quite nicely, and we use this all the time. This is how the world goes around. Really, above this, there's a thyroid releasing hormone in the pituitary, which stimulates the thyroid stimulating hormone, or that TSH, in the pituitary. It's a detective. It detects how much is in our system. If there's not enough, the TSH will tell our brain to make more. It'll tell the thyroid to make more. If there's too much, it'll tell it to make less. And so that number that we get is an inverse. So normal range is usually about 0.45 or 0.5 to 4.5. 4.5 is low, 0.5 is high. So patients get their lab work and they see a lab value of 0.3, which is high, and they'll say if they're taking medication or some of our remedies here, they'll say, well, they took more because their levels were low, and the levels obviously will go lower because it's an inverse. It stimulates the thyroid to convert T4 into T3. You need selenium and iodine for that to happen. And if you don't have enough of that, it won't happen. And that's where we get the reverse T3 or the inert T3. The free T3 is the part that does the work, but it needs some nutrients also, including an adequate amount of protein to make that tyrosine, zinc, selenium, vitamins A and D, and it does need a little bit of EFA, a component of fish oil, to distribute it adequately into the tissues itself. This is just a schematic of pretty much everything I just told you. In the yellow, this is your typical medical doctor. The failure to convert T4 to T3, they'll order a TSH with a reflex to T4 sometimes. If there are any other diagnostics, they'll say, well, you have to go see a specialist. Diet doesn't matter according to our what I call white bread medical people, and medication is levothyroxine only, and if you use anything else, you're outside of the bounds of medicine. We do all of these things on the right here. You see there's a lot of specialty tests that we'll do. We'll do a 24-hour urine iodine. We will get selenium. GI function is usually compromised, especially with immune issues with the thyroid problems. The reason is that 80% of our immune system resides in the small intestine. So it's not uncommon to find small intestinal bacterial overgrowth and food intolerances and digestive dysfunction. So we'll sometimes do a functional GI test. We want a strict gluten-free diet. And those of you who've ever watched Judge Judy, I say it's a Judge Judy deal. It's a yes or a no, not 80%, not 90%. Not I cheated here, not cheated there. You either do it or don't. And we emphasize this over and over again. We have a program we do where we send the patients recipes and menus. They get them every night for about 90 days, and they can keep them. And again, gluten-free recipes. It'll have shopping lists and little tips and tricks on how to stay as gluten-free as they can. Our remedies are, if we're not using medications, that we're going to talk about constitutional homeopathic remedies, brain remedies, kidney liver detox, immune support, thyroid materials, thyroid nutrients, and and I have an extensive list of symptomatic remedies for particular thyroid issues. This is kind of an overview of the scheme. Again, we're going to start with a gluten-free, dairy-free, low-carb diet. We're going to talk about constitutional homeopathic remedies. We'll then talk about some brain-activating remedies. A lot of these patients end up with brain fog. Liver, kidney detox and immune support, and then some specific thyroid nutrients and remedies there. So again, gluten-free, dairy-free, lower carbs. I love this quote from Mark Twain in the late 1800s. The only way to keep your health is to eat what you don't want, drink what you don't like, and do what you'd rather not do. I'm not going to go too extensively into specifically a gluten-free diet. That's a topic for another day. But gluten contains a protein called gliadin, which is found in wheat and rye and grains. And it's a major stressor of the junctional walls of the small intestine. The junctional walls of the small intestine are a single layer that protect us from foodstuffs that should not get into the bloodstream, bacteria, foodstuffs, inflammatory products. When these are loosened, and the gluten is those that are sensitive to gluten, it happens quite frequently. The microbes and the food particles have a clear path to get into the bloodstream. The junction between the cell walls is held together by a substance called zonulin, and when the cell walls are weakened, zonulin will leak into the bloodstream, and we can measure this either in a blood test or even in a stool. High zonulin levels are indicative of this. This is what we call the leaky gut. Here's several foodstuffs that have goitrogens, or have foods that slow the thyroid down. So if you're hyperthyroid, these are good to indulge in. If you're hypothyroid, which remember 98% of these patients that we see we want to avoid them in one fashion or another. Now you'll notice the cruciferous vegetables are what things are foodstuffs that we tell patients to eat, especially postmenopausal females. So the compromise here is that what we found is that these foodstuffs, if you have them broiled or steamed, will cook out the goitrogen or the chemicals that slow the thyroid down. So we want our patients not to have these foodstuffs in a raw form. Cooked is more than acceptable. And if they can skip these once or twice a week and be goitrogen food free, all that much better. So does that mean if they have a spinach salad, they're going to die? No. But again, it makes it that much harder. Again, so if you look over here, some other things on the right, I mean, I don't know anybody who's going to eat raw sweet potatoes, but we do have patients who come in and they have a spinach salad every day, and then strawberries and pears. Those are popular. So if we can have them slow down a bit, especially in strawberries, pears, peaches, if that's their favorite, to maybe 3 to 4 times a week instead of every day, every little bit helps. On the left here, you'll notice broccoli, cauliflower, kale, all the cruciferous vegetables, which we encourage for menopausal symptoms and premenstrual cycle symptoms. But with those patients that have the hypothyroid problem with the menstrual cycle, we make sure that we want these foodstuffs to be cooked. This is just a brief way to repair them. You remove the bad guys here. So caffeine, alcohol, gluten, dairy. Sometimes eggs, you need to test that out. Some patients are okay with eggs, whites and yolks. Some are not. To repair it, we want to repair the lining of the intestinal wall with omega-3 fatty acids and some healing herbal remedies, aloe vera, turmeric, evening primrose oil, L-glutamine. We want to restore the intestinal bacteria with fermented foods and probiotics. And now we're looking at something, I'm just going to mention it, but I don't have time to go into it, called postbiotics. Look that one up. And some high quality digestive enzymes. That's the repair. These are specialty tests that we do. The one on the left is a stool test, and that'll give us all sorts of information on maldigestion, inflammation, dysbiosis, metabolic imbalances, and infections. And on the right, a SIBO. This is a food sensitivity test. And then here's some strategies for reducing thyroid antibodies. These are herbal remedies, so I'm not going to mention them today. Constitutional homeopathic remedies. Again, on the left here, the medical doctor remedy for everything is levothyroxine. On the right, patients that have physical issues, we like calcarea carb and graphite. Emotional issues, patients, anxiety, depression, which is frequent with thyroid disease, sepia, some mental issues also, we like argentium. And for energy, thyroidium, you're going to see that over and over again. A supporting remedy is spongia. So a calcarea carbonica is for patients with slow metabolism, fatigue, weight gain, and cold sensitivity. Remember, those are the symptoms, major symptoms of hypothyroidism. In emotional and mental profile, they are stable. They have a practical personality, but they can be anxious, and they can feel overwhelmed by responsibilities. And the physical traits, they're stocky, solid build, and they struggle with weight issues. You can actually almost picture that person walking in. Graphites is physical symptoms. These patients are sluggish and they're obese. They have cold extremities, chronic constipation. Emotionally, they're mild-mannered with low self-confidence, indecisive, depressed, and they're sensitive to criticism. constitutional physical characteristics. These folks are heavy or slightly overweight. They have pale skin and a tendency for skin eruptions, particularly around the ears and scalp. They have delayed wound healing, and it reflects an overall sluggishness in metabolic process. Sepia is for hormonal imbalances with fatigue, cold extremities, a tendency to feel chilly with low energy, and a sensation of heaviness or weakness in the lower abdomen. Emotionally, they are drained, irritable, and indifferent. And physically, these are lean, wiry, stocky patients with cold hands and feet, and a yellow complexion, and dry skin, dry hair. They have that kind of wild, frizzy hair kind of look. Argentium which is silver nitrate. These are patients that have GI symptoms. They crave sweets, and the symptoms get worse in the summertime or when they're excited. They're dizzy, they tremble, they have sensations of difficulty swallowing or breathing, or constriction in the chest or the throat. Emotionally, these patients are anxious and impulsive and excitable. And they feel hurried and tend to worry about the future. They fear impending misfortune is constant, and anxiety manifests physically with trembling or digestive issues. Generally, they feel worse in confined spaces with extreme heat and from mental exertion. And lastly, thyroidium. These experience fluctuating energy levels. They suffer from skin issues like dry skin, dry hair, hair loss. They have mood swings. They're irritable. They have difficulty with all sorts of hormonal imbalances, brain fog, low motivation. They have a tendency to gain weight. They look swollen, particularly in the morning, and they exhibit low vitality with cold extremities. Brain activating remedies, what comes next. And these are combinations that we found that work quite nicely. So this is a brand. Since this is not CME, I didn't have a problem using this. So UNDA 228 is a combination that to restore neurotransmitter functioning. It's for nervous disorders following shock, grief, or depression. Brain support, phosphatidylserine. This is actually a Western herbal remedy. This works quite nicely for memory and attention. We use this anywhere from 100 to 500 milligrams daily. I forgot to mention, usually we start most of our homeopathic remedies, the single remedies, at 200 C for 2 to 4 weeks, and then we drop down to anywhere from 6 to 9 C to 12 C, depending on their response. For brain detoxification, we like UNDA 9, which supports the nervous system, particularly in case of nervous exhaustion. And for brain restoration, UNDA 22, for nervousness, anxiety, hyperactivity, and sleep disturbances. So and we pick out, the symptoms that our patients are complaining about and match it to the remedies that we're looking at. For the detox or immune portion, thyroid activating remedies was UNDA 16. This is for digestive support. Remember, we mentioned GI symptoms are quite frequent with thyroid issues. So for liver and digestive harmonization and bile flow improvement, lymphatic drainage, and skin and mucous brain conditions, UNDA 19 is our homeopathic go-to. For thyroid detoxification, so patients that are anxious and emotionally overwrought, they have some liver dysfunction. These are patients that probably are more hyperthyroid. There's a UNDA 273. To detox, we like UNDA 1. This is our conversion of T4 to T3. This would be the homeopathic version of your levothyroxine for sluggish metabolism and digestive issues. It restores mental clarity, and its constitutional build is low energy. For kidney issues, and I don't usually see a whole lot of kidney issues with thyroid disease, but if they do exist, we want UNDA 2. Which supports mental and emotional clarity and mood swings and stress. And our constitutional build, the patient has a robust build but chronic health issues. So thyroid immune modulators. So these are for thyroid antibodies. This is a Western herbal remedy. I like this one a lot. We use this quite frequently. This is a natural sterol. It's called Magicare, and it's made by a number of different companies. The one we used to use mostly was Thorne, but they stopped making it. But it's Designs for Health has a version of it called Foresterol. You can find Magicare in a lot of different places. It's a natural sterol. It improves the balance of T helper cells 1s and T helper cells 2. It downregulates immune responses. It protects against reactive oxidative stress. It will it will improve your cholesterol profile also, and it modulates the autoimmune response in Hashimoto's thyroiditis. On average, it will decrease the thyroid antibodies by about 50% per year. And we've had patients decrease. We've not had them go to zero, but we've had them decrease by up to 90% over a lifetime of use. So if you find a patient with a elevated but low elevated, so remember I told you less than 9 is our cutoff for thyroid antibody, the TPO. If they show it up at 12 or 14, when say, well, it's not that bad. You want to take care of that right away, because if they come back in 5 years and haven't addressed it, now it's going to be 300 to 500, and their thyroid will be totally replaced with lymphoid tissue. So we want to take care of this as quickly as we can. So again, 50% within a year. If they're at 18, within a year, the patients should be back to normal. Normally, most of the time patients show up and they don't know they have thyroid antibody issues. The TPO is 300 to 500. And so 300 in a year is 150, in 2 years is 75, in 3 years is 35 to 40. In 4 years is 20, in 5 years is 10. So you see, it can be quite extensive if we don't get it early. There's another one. It's actually an enzyme. It's called Wobazyme N. There's lots of Wobazymes. It's made by Douglas. There's lots of them, but we want the Wobazyme N. This is, again, a phytosterol. It has complementary activities. It is active against the autoimmune antibodies. It's not as potent as Magicare, but it's a lot less expensive. Magicare is about $50 a month, and the Wobazyme N is less than $20. There's the references for all of the plant sterols. So I always like to have, my doctor said there's no evidence of, so if you put in no evidence of, these plant sterols of helping thyroid antibodies, here's 51 references just on those. And I haven't updated them in a couple of years. So thyroid specifics, micronutrients, thyroid minerals, thyroid nutrients, specifically for immune support in the thyroid, in the homeopathic world, are UNDAs again, UNDA 37 for liver and GI symptoms, UNDA 15 for kidney and urinary symptoms, Calcarea phosphorica for slow metabolism, fatigue, weight gain. These are single remedies. If that's your ilk, I like to go with the combinations. We get a little bit more bang for our buck that way. We hit more than one or two symptom clusters at a time. Mood and cognitive function improves. Mental fog, anxiety, and depression. With the Calcarea phosphorica. Calcarea sulfurica is, again, for sluggish metabolism, but with skin issues, particularly acne or eczema. Emotional and mental profile relieves irritability and frustration with mood swings. And constitutional build is a robust patient. These are usually younger with persistent skin and inflammatory issues. I had a patient yesterday for the first time, 22 years old. He's had eczema and scalp dandruff, quite severe for many years. He does have GI issues that go along with it, obviously. So we're working on that. But this was our one go-to right away for that. Calcarea fluorica is, again, with weight gain, low energy, and issues relating to tissue elasticity. So this is sort of the stiff person syndrome. They're apprehensive, they're anxious, and they're emotionally overwrought. They have a sturdy constitution with connective tissue weaknesses. They have a lot of joint issues, sometimes varicose veins. Kali, Kali phosphoricum patients have slow metabolism and fatigue, emotional and mental profile issues. They promote mental clarity and mental exhaustion. And constitutionally, they're slender or have a delicate constitution. Kali sulfuricum have a sluggish metabolism with fatigue, skin issues that are related to the thyroid, emotional issues with mood swings, irritability, and emotional instability. And they are a medium build with signs of chronic fatigue. So we look at their constitution and match the remedies to the constitution. This is another herbal remedy that has tyrosine, ashwagandha, a lot of adrenal support here, and vitamins A, C, and D from pure encapsulations. That's this one here. It has also has iodine and selenium in it. If they're hyperthyroid patients, you want to avoid iodine. Selenium 200 micrograms, zinc 20 to 25 to 50 milligrams. And hyperthyroid patients, we like bugleweed and lemon balm are quite potent at bringing the thyroid function in line. This is a summary of everything that we've just done. Anybody wants the slideshow, we'll send that on to Dr. Zarin, and she can get that. So the constitutional assessment, brain function, thyroid stimulation and support with the remedies over on the right-hand side, liver and kidney detoxification, immune support, diet and nutritional adjustments, and spiritual and emotional adjustments also. Okay. I think I'm going to stop there, Dr. Zarin. I have a couple of minutes, 4 minutes. We'll take some questions. And since tomorrow I have another half hour, I'll do specific homeopathic remedies for the thyroid, if that's okay. I think I'll do it that way. Okay. And by specific, I'm going to show you that, so that for hyperthyroid, we're going to talk about specific remedies for all of the symptoms. And for hypothyroid, we'll talk about all of the symptoms. So we'll talk about remedies for exophthalmos, hair changes, increased sweating, rapid heart rate, weight loss, tremors, menstrual changes, and diarrhea. And remember, it's the opposite for hypothyroidism. So I'll take questions there, and I managed to do it in
Awesome.
on time.
You're right on time.
Yeah. So
amazing presentation. Thank you. So informative.
okay.
And I was wondering with the Hashimoto thyroiditis, because like the autoimmune disease is one of the main field that medical doctors in allopathic medicine have some issues for treatment. Thank you
Right.
so much.
Right. So I always tell my students, if all you have to learn is thyroid, you see how many organ systems we touched just in the little bit of time I talked about. We talked about hair, we talked about nails, we talked about the heart, we talked about the GI system. It goes way beyond this little gland right in the neck here. And so if you learn, if you can learn, you can make a whole career out of just treating actually Hashimoto's thyroiditis, which again, if you're not familiar with it, it's low thyroid from your immune system. And that's the root cause. And, you know, the medical doctors tell us we don't need to do that. Remember, I'm a medical doctor. You don't need to worry about that. That doesn't matter. Also, the diet doesn't matter. So, but those of us here at the BioQuantum Academy, we know better. Right. That's why I have a 6-month waiting list. And if you call the endocrinologist in our town by 9 o'clock this morning, she'll tell you, "Oh, come over. How about a 3? Can you make it here?" So, and then they wonder why everybody flocks to us.
Yeah.
So,
Thank you.
any other questions, comments?
Excellent as always. Dr. Clifford is the faculty at the BioQuantum Academy and at the medical homeopathic department. He's teaching this course, and I think a lot of different courses as well. So for the diploma program. So if you in the future you want to be a medical homeopath, so here you go. Bioquantum Academy is offering it to all of you with the best knowledge of, homeopathy and from medical perspective, from a classical perspective, and just join us.
Yeah.
Yes.
There's a question here. Can a liver detox with under 2 be used for other than thyroid disease? Oh, under 2. It says under 2. Yes, you can use it for any type of liver detox. Do you agree with that, Dr. Zarin?
Yeah.
We use it for that.
I have some mistake about under. I mean
Under.
it's
I got it. Under.
under.
UNDA. Yeah, that was
Yeah, okay.
the remedy that
Yeah.
combination remedy. Yes,
Oh.
we use it for all of our liver detox patients. I use that first line. You really can't go wrong with something like that. And actually, it doesn't really matter what the issue is. They all have liver congestion. So.
With permission to get from Dr. Clearfield, I just want to make a comment on this, that definitely he's an expert on hormones and thyroid, but generally as a holistic approach, you know that T4 is made by thyroid, right? But it's not the one that the body can utilize it. It has to use one iodine molecule to become T3 in order to be used for the entire body. Who does this? Thyroid doesn't do that. It's liver. 85% of that, losing one iodine of thyroxine, is done in the liver. And the other 12% is in the kidneys and the rest in nervous system cells. So that's why Dr. Khalifa mentioned the detoxification of the liver and kidneys are very, very important in order to have the right metabolism, because the body works holistically and all the organs, they work in collaborations. So thyroid makes something, gives it to liver. Liver is doing something in order to utilize it. So a liver drainage is a huge deal. Liver detox in almost every single chronic conditions, especially when the problem is metabolic conditions. So that's why in all thyroid problems, personally, it's adaptogenic. So we do liver drainage and to a point kidney drainage as well. Thank you so much, Dr. Kellerfeld. And
thank you.
We have
Dr.
one more
Sari.
question. We have one more question from Dr. Raftika. How about using levothyroxine if we use homeopathic medical remedies? Could we use it together or not?
Most of the patients that we see come from other practitioners, and in my case, a lot of other doctors, and they're already on levothyroxine, and we'll do a crossover anywhere from 4 to 8 weeks. If they agree, it's really sort of patient independent. We'll try to ease them off the levothyroxine, but if they've been on it a long time, we're pretty much dependent on it. So if we can reduce the dose, that's great. If we can get them off it, that's great also. But I don't rush it. We tell them we want to fix everything yesterday, but that's a slow process. I mean, you really have to, it's almost like an addiction. You really need to go start low and go slow, and so figure out what your constitutional remedies are. Slowly bring up those remedies, and we'll slowly decrease the thyroid medication and do a crossover that way. Okay.
Thank you, Dr. Clearfield. No more questions.
Okay. Thank you.